and thank you so much for joining us today for the webinar Discover the Next Generation Composite that Elevates Your Artistry. We would like to thank Professor Antonio Cerutti for being with us today and our sponsor for making this lecture possible. Please take note of any questions and comments you have during the lecture, as they will be addressed by the professor at the end of the presentation. Without any further delay, please help me welcome the expert himself, Antonio Cerutti.
Hello everybody, thank you for being here together and to share this experience. I'm really proud to introduce the argument of anterior restoration because more or less this is our business card for our daily profession, because our patient want aesthetic, and when we use composite in anterior restoration, usually we implement our skillness, our experience, our perfection, and our patient judge us. So it's really important to make a sort of integration between art on one side and material on the other side. So it's for us so important. Before beginning, I want to thank CARE for this great opportunity. We collaborate since many years in our university in research on one side, in education on the other side. So I'm really proud before beginning this webinar to introduce my city. This is some typical Italian landscape regarding art and culture. And in this webinar, I think that art is one of the topics, because in our profession there is always some artistic that we have to implement. So I live in there's a big city is located in north of Italy. What you see in the circle is the major hospital of North Italy. So we share a lot of experience, not only in dentistry, but also in a full field of medicine. So what makes the difference is also my profession. This is my office where I'm speaking. So it's for me a great honor to introduce something, a good, relaxing, high perfection place to implement our art and our dentistry. So we go deep inside the webinar. This webinar is sponsored by CARE. CARE is a big company. I know CARE since many years because I grew up with this material. To grow up with the company makes a sort of connection, even though I'm really skeptical regarding something new. I'm a researcher on one side, and 50% I'm professional. So what I teach in the morning, I use in the afternoon on my patient. So the connection is really speaking. That's why I wanted to share with you something related to daily practice. Excellence is something that must be applied every day. Excellence for every day is the key of the success in my teaching and professional philosophy. So these are our challenge. The challenge that is related or regarding what the patient can easily see. And what the patient can easily see is also a double face situation. On one side, we are proud regarding our restoration, closing the diastema, restoring something that we lose, and at the same time to create the emotional connection between the restoration that restore what the patient lost, especially for dental trauma that we so many in our hospital. Regarding the morphological correction, I think that at the moment composite is the first choice, because minimal intervention and with saving tooth structure, it's the key of minimal invasive dentistry. So the menu of tonight, for me tonight, for many person is a midday, is to talk about composite anterior restoration first, to create a sort of state of the art regarding how to proceed in many situations, from fragment reattachment to immediate restoration to delayed restoration. I avoided really complicated situation because I want first to place a milestone regarding how to proceed. Proceed in the sort of innovative materials and procedure to use better the adhesive dentistry. Adhesive dentistry is not a material. Adhesive dentistry is a concept. Adhesive dentistry wanted to make the situation easy. Easy is not simple because we have some rule to respect. So what we are doing now regarding this aspect is to introduce the daily protocol. Many situations. This is the typical situation that more or less is frequent in our office or in our hospital, that make the situation regarding what to do for our patient. What to do, it makes a sort of combination between skillness of the operator, use of the proper material, and desire of our patient. As a parent, what I want when I would imagine my son or my daughter with a trauma is to go back 5 minutes before the trauma and try to avoid it. So what I want and what I pray for is that the dentist can reconstruct, rebuild the situation, saving tooth structure, but also saving tooth vitality at the same time, because we know that tooth vitality is really important. The first problem that we face with the dentist is the color. The color it's a big game, big challenge, because we relate the color perception regarding the material, but it is not true. Color is a combination between observer, the light, and the material. This strict connection make the sort of color. As you see in these two images, it takes just 5 seconds under the rubber dam isolation to change the color of surface. The saliva evaporates and the tooth remain dry. This dryness make this tooth more high value tooth, so more bright. So if we choose in this situation the color, we have 100% in success. The color what we choose before the restoration. The second aspect is the layering procedure. How to layer our tooth. Layer procedure is a difficult situation. Layer procedure makes it's biological situation and require biological approach. This approach combines the two tissue, dentin on one side, enamel on the other side. I'm so sorry, but for the daily practice, we have to combine these two tissue with two different materials. This is at least two materials. So how to manage the situation when we finish and we remove the rubber dam and we take a look that the situation is more or less acceptable. But at the same time, we know this is unreal situation because this tooth is dry. The real color we can appreciate in the second visit. That's why we always say to our patient, please go back after 1 week so we can evaluate tooth vitality, we can evaluate morphologic situation, we can make, like as you see in this case, a sort of repolishing or little modification in case we make some mistake. We work so we can do mistakes. And this is the final situation when our patient, a young patient, is out from our office. So adhesive dentistry means to use this procedure with minimal intervention. So at the same time, the follow-up is really important. Usually we forgot our patient and we don't evaluate. And after 9 years from our restoration, something is changed. Our patient received orthodontic treatment. At the same time, the composite is visible not in a social life, but in a closer view. So our patient now, she's not a baby. She's a young woman. So she wants aesthetic now. What we can do at the same time is to use adhesive situation for rebonding material to maintain the shell, the composite shell, to clean the surface, because we know the cleanness, we improve the adhesion, and then to refine just the enamel margin. With this situation, we can restore easily following our rules. We can restore without any problem, etching the enamel, cleaning the composite, then use the adhesive in a correct way, following the manufacturer instruction, and then apply composite. This situation is quite simple because this tooth is without any translucency, any characterization. We need to remember that inside we need some dentin material, really opaque, without reflecting light, just to stop the light and avoid that the light diffuse inside, creating the unpleasant gray line or gray approach. But because finishing the surface and design the macromorphology is the second key point for the success. I scrub the surface with articulating paper because I want to always to use during my finishing procedure water spray. So I want to remove the superficial layer of composite inhibited by oxygen of my office. So the polishing procedure goes on, and then I have this kind of situation, always with the water spray, always with low speed, always with disc and rubber cup and diamond paste with the wheels, always low speed, always. So when I finish my restoration, I can feel happy regarding the success I gain. And I am more happy when 10 years later, I evaluate my job. This is my, my business card for my patient. This is what I want for my patient. So the occasion regarding class 4 is closely related to trauma. Trauma is something that is break your life and break our patient teeth. Many of us are not ready regarding this emergency, because this emergency is usually referred to the first aid hospital or dental hospital. But we needed to face with this situation. If we use the fragment, we needed to reattach the fragment and use the composite as a bridge between the fragment and the tooth structure. Or you can use just the composite for immediate restoration or delayed restoration to make sort of reintervention of previous situation. We imagine to restore these young kids. So during the trauma, our first aim must to save tooth structure. In this analysis that I recover from my clinic in our university, we evaluate a lot trauma. The trauma, more than 60% are related to permanent teeth. And of this permanent teeth, 80% upper incisor. So something that remains for all patient life. So what is really important is to maintain tooth vitality. Regarding this aspect that is really controversial, the review, the papers cannot help us because everything is related, everything is addressed just to operator skillness. And the second topic is the age of the patient. So when we have the bleeding like that, usually I apply what my good friend Trevor Burke, I collaborate with him regarding the paper Ethic of Aesthetic. Now, he introduced the daughter test. What would you do regarding your daughter teeth? In my opinion, I try to do my best to save tooth vitality and to open with the calcium hydroxide or MT8 to close the bleeding opening hole, and then hope that the complex dentin pulp will recover the vitality. After this step, everything is demanded to the adhesion. So we need to evaluate the tooth and the fragment adaptation, and then to mark some referee point. Afterwards, adhesive procedure, enamel, fragment, adhesive on the enamel, and after that, we know that when we apply orthophosphoric acid, I take a look from the book I wrote with two friends, and it was written in 5 languages, a guideline for adhesive dentistry. When we apply orthophosphoric acid, we have a superficial demineralization of the enamel that create a beautiful structure. This beautiful structure is fantastic for adhesion, because creates something fantastic for the adhesive to go in the cave, in this holes on these spikes, or better, as we see in many situations of treated and untreated surface, we see a sort of mix. Anyway, in this situation, the adhesive can penetrate, and during the polymerization create mechanical link, really strong to for a long-lasting procedure. We know regarding the adhesion that the best thing of performance we can achieve with rubber dam first, with action rinse adhesive. And rubber dam is something not demanding. We need to use every day in our life, and it is not something new. This tool became from the past. Yesterday was 150th centenary regarding the rubber dam. So I always encourage and I oblige my student to use rubber dam. And I encourage anyone, because rubber dam is the best adhesive we can do. And this is confirmed by many papers. So when we decide then to use the composite, the first layer must be fluid composite, just on the dentin, to adapt the situation in a proper, adapt the fragment in the proper position. Afterwards, another layer, dentin material, to stop the light, to avoid the light to diffuse in, and then can create a sort of gray line. Enamel, and afterwards we clean and polish perfectly, and we say to our patient, we see you in 1 week. And after 1 week, we saw that everything is clean, is polished, the fragment is in the right position, but the tooth surface is not the same of the opposite one. So we need to create something equal. and the created surface structure can be delayed in a second visit. What we use to create this rough surface? If you take a look here, there is difference in macro and micro geography. So we take a prosthetic burr, a diamond burr with a high grain consistency, and then we scrub the surface. And the next step would be something really polishing, brush with water without diamond paste to create and to clean just the surface. The final result regarding this aspect is from left to right to create this kind of rough surface that reflect the light, and so create a sort of homogeneity and make the time go back before the trauma event. When we don't have the tooth fragment, what we can do? We can create the dental features, creating dental features in a proper way. Dental features must be cleaning the margin, creating a finishing line with the 45-degree bevel or macro chamfer, and after cleaning the surface, select the proper composite. To select the proper composite means to create something that is closely related to two big categories. One is composite using for layering the enamel that we apply on this silicone index that create the shell of our restoration. We can create the silicone index using taking impression and then to use a model for study model, and then to create a wax to recreate the situation, especially when you have some morphological doubts or morphological problem. And after creating the shell, then you have to use a different material, completely different, opaque material to stop the light and to create the denting. After the observation of the real tooth structure, the sound tooth structure, we need to apply this material. So this is the key of the success. We try to explain this step by step using these two material. And this is the first approach, as you see here. To create the shell, we check afterward the denting, chromatic, and the third effect, take a look on the margin to avoid the gray line. Afterwards, if you need it, characterization, if they are needed, especially for the white, and when we finish with enamel. We finish with the same enamel we use for the parter side. So 2 increment, 2 step for having a good result like that. Incisal, dentin, enamel, and the high value dentin to simulate the incisal edge, and then we finish our restoration. So this is the typical protocol, step by step, corroborated by X-ray, where we can see more radiopacity on the dentin and less radiopacity on the enamel. This is quite normal. What is try to be normal is to have a sort of homogeneous effect, homogeneous integration between the natural and composite. So this sort of connection is really important for the patient, because during the evaluation after the treatment, the patient wanted to have a mirror, or immediately when he arrives, or when the patient arrives at home, wanted to check the result and show the result, because patient want to have something that corroborate the aesthetic, the error that we can introduce during this procedure. Dark white composite, the correct selection of the masses that can modify the reconstruction in value and appearance. For instance, if you don't use dentin material, dentin composite, we have a gray restoration, or we have a gray line on the margin. The opposite, if you use too much dentin material, we have a really chromatic or high value restoration. And we have always to remember that the background can condition the final result. So we suggested to use a dark paper to or a dark flat panel to evaluate first the situation regarding this background. To also white if we wanted to appreciate the halo. So color situation. We know that there is a strict interaction between this situation, and I always encourage you. I wanted to force you to evaluate this connection, because when we mistake, the fault is not of the composite, but the interaction between the composite, the light, and the observer. And the first step to avoid the problem is take a look at this couple of natural teeth. These teeth are fantastic. They are sound, completely sound. On the left side, easier tooth from the color and the translucency, but really difficult because the wrinkle and the perichromacy on the surface create a sort of fantastic but really difficult surface to create. On the other side, on the left side, on the right side, we see translucency, blue, amber, white, that can combine together with this sort of aurora, northern aurora. So this is our battlefield. So we needed to try to combine always the shade with the color. I think that this is the key of the success, because in this case, that as you easily imagine, we have a sort of really combination between morphology and color to rebuild the situation after two previous reconstruction. We know exactly what we have to do regarding this aspect. First of all, is really important the diagnostic approach. Take a look at the tooth structure, or always imagine what we have to do regarding this aspect. So take a look to the teeth, then to select the color, and after selecting the color, try to evaluate the adhesion of this tooth. And after this situation, what makes the difference is try to do something that is really connected with the preparation. Just removing previous restoration. And after that, to create two enamel finishing line. Enamel finishing line are really important because the enamel finishing line created the barrier, the border between tooth and composite. In all around the perimeter, the finishing line is 90%. Just on a buccal situation, we can create 45 degrees bevel or microchamfer. What makes a difference? At the final restoration, you will see that if you layer the composite in a proper way, no difference will be from the aesthetic point of view. It's really important to place on these two surfaces enough composite and right composite to create a good aesthetic effect. Adhesive procedure proceed normally with phosphoric acid, rinsing, placing the adhesive in a proper way, isolating tooth structure in a proper way, and after removing this situation, rinse correctly. just a brush. Then we have to apply etch and rinse material. I use my Optimum Solo, and then I cure. So what makes the difference regarding the adhesion? Adhesion is a sort of physical reaction on enamel substrate. So you have to select two family: total with total etch and rinse, on etch and dry. It's important in the adhesion strategy that you follow the rules. Then you can, if you follow the rules, you will be successful. And you cannot mix the situation. Then select the adhesive strategy basing on the substrate. If we have enamel, I always prefer, but it is my position, it is just a clinical position. I don't want it to have, I would say, I want to say just my position. I don't want it to state anything, but at the same time, if I have enamel, I prefer to use orthophosphoric acid. And on the dentin, self-etching procedure when in the posterior. In the anterior, since a major of the tooth is enamel, I prefer etch and rinse. But then it's up to you. And then use my shades. Use my shades in a proper way. Basing on the fact I have a composite layering procedure first. What helped me is the silicone index. This silicone index that I create on ceramic, on the wax, on the diagnostic wax, I insert and transparent matrix to create the first layer, the shell. The shell is really important for us because inside the shell, created with enamel on the part of the surface and with the opaque dentin, for interproximal, I place inside something really important. This the dentin layer. The layering of the dentin is more chromatic to reproduce the mammalus or other dentin morphology is based on the imitation of the nature. This is my layering to create a halo between the dentin more chromatic and the high value dentin that created the border. And I finish with the enamel situation. This is what I use normally. This is what I do in my everyday practice. No difficult instrument. Something that is really normal. As you see here, this is a normal spatula. I use the wedge, gentle movement without any situation. On one side, I use an instrument. On the other side, I use the other instrument. Three instruments. One PK Thomas number 5. One spatula, and afterwards one the probe. It depends. The material is really easy to apply if we treat properly, if we treat gently, if we apply with a small touch, without forcing, using try to amplify the characteristic of this material. So after doing that, what we I'm sorry, we're back. Is it to a finishing procedure? The finishing procedure is always, as you see here, under water spray, and to gain this sort of result after removing, as you see, the rubber dam. I speed up this procedure, but in every procedure you see that, and every situation you find something that is really common. What is common is quite simple to explain. What we see now is completely different from the final result, because our restoration will have a chameleonic effect, just basing after removing the rubber dam. And as you see here, this is before removing the rubber dam. Our restoration appears completely wrong, completely different. But when we remove the rubber dam and then we check in the second visit, everything appears completely different, because the wedge effect that we use on the papilla is disappeared. So the contact point is renewed, and then everything is completely integrated. So what makes in this case difference regarding this aspect, that we always need to appreciate the Ferrocane guidelines. Multifactorial means that the filler technology must be combined in this year, must be combined with something that is really no. The filler technology in this year move from big particles to ultrafine particles, like in material I use in my daily practice. But in our hand, now we have composite more performing, more technological. And I wanted to introduce this material that I had the opportunity to have a soft touch. That means I use a lot in my in vitro evaluation and in my in vitro study, mostly for this material is based on the fact that is infused with adaptive response technology, nanoparticle filler technology that give us the opportunity to imitate and mask, imitate the nature behavior, and leave your restoration easier to perform. Easier, I think, is quite the opposite regarding what we do every day. But I want to go in the deep regarding the situation we have in our daily practice. We know that the reflection and the propagation of the light is just in two fields, specular and diffuse. And when we have specular and diffuse, we know that basically we have something two different. At two different wavelengths, we have different diffusion. When we interact with the lower wavelength, example blue, the human enamel reflects more diffuse light. And on the opposite, when you interaction with the higher wavelength, the human enamel reflects more specular light. So if we wanted to have this kind of situation, we needed to use something that must be really close to these two light events. So to have something like adaptive response technology in the filler that created this sort of new situation. And that this is what makes the difference is created by technology. This technology is to combine on one side the zirconia 5 nanometer with the silica 20 nanometer. And with this connection is something creating with the high technology in the sort of situation that create a sort of agglomerate with the cluster. This cluster is connecting together in a reinforced structure, but it is not the cluster usually. There is a patent regarding this mechanism that I at the moment, even I don't know to explain, but something completely revolutionary regarding for having this cluster really homogeneous. there's a spherical situation, really homogeneous, that on one side creates something reinforcing, on the other side is a similar, create a sort of aesthetic result similar to human enamel. That creates a sort of blending. The blending between what we like to introduce a colorant in water, and that this blend creates a sort of mixing. This mixing creates a great aesthetic effect. This great aesthetic effect is, as you see here, is explained by the specular reflection when we use harmonize. And when we have a high and lower wavelength, we see here in red, blue, and yellow diagram that the angle is completely homogeneous, not without any drop that usually appear in the normal situation. A simple explain regarding this effect. When we have a light scattering, we see the view of the top, the view of the side, we see this effect. On one side, more yellowish when we view from the top. On the other side, blue light when we look from the wider angle. So this kind of chameleontic situation can be easily used for creating really artistic effect regarding care harmonize. So we know regarding this material some aspect that we have many masses regarding, but really traditional on one side, dentin, enamel, and inside. I wanted to let everyone know better regarding this material, and one is it's to know that we know that we have many situations that in where we have a sort of masses. Mostly we use A. A is the base of our job, even though that we have a B, C, and D. We dentists are used to think about A material. So dentin in my in vitro test, these are my favorite dentin, using for reconstructing the core of the restoration. And these are the enamel I use mostly. But in these two situations, we have also three really interesting incisal masses: amber, clear, and gray. My favorite is always clear, because chromaticity and value I create with the dentin. So if I want to appreciate chroma on one side or value on the other side, is just enough to apply clear material to appreciate what is I can find what the aesthetic result belonging from the inside. What makes for us a great difference regarding this filler is also that it's a nanoscale filler particles, but with high technology give to us the opportunity to create a sort of really shine surface and maintain luster and gloss over time. For one reason, because if I have high particles on the surface and we lose this big particles, we have the roughness of the surface and we lose the shiny surface typical of just polished composite. But if we have a small particle, and in this case really regular clusters, in case of we lose our particle, the surface remain completely the same. This makes a sort of really difference regarding this aspect, because when we have a situation like that, this is my endodontically treated tooth, class 4. And as you see here, there is a marginal edge, and I recreate all of the buccal surface in this case, for create the clean surface without any wrinkled surface, without any perichromatia, without any microgeography defects. I need to have a material that can be last clean perfectly. The problem in finishing and polishing, yes, we have. We know that the wrinkled surface is easier to create, and at the same time reflect more than high polished surface that leave the light, goes in and spread inside, created the unpleasant gray that in some situation we have. So we know that in our end, we have the possibility to have fun and to create a direct restoration, because the technology, adaptive response technology, gives us also the possibility, the second possibility, to adapt to the clinician behavior, maintaining the softness on one side and the shape on the other side. So it's easy to sculpt, and I always invite you to read our paper based mostly on the experimental harmonized and in comparison with Herculite, where we evaluate the different shade and the thermomechanical viscosity stimulation on the rheological, basic on rheological properties. And we found that the easier carving is possible to be created and to be improved thanks to the rheological adaptive, the same we have in the sonic field that many of you know and use every day. So when we face the situation and we test, as you see here, on resin tooth, and to make a sort of in vitro test regarding this aspect, you use enamel, you can use dentin, you use the dentin and you sculpt the dentin in a different way, and you needed to create the friendship between you and this new material, and also with the enamel inside the shell. And you can finish with the enamel and or incisal or just enamel to create the effect you want to represent in your patient. I always encourage you to do this thing, because in case you test and you manage in these two layers with these two masses properly, you can face many situations. Like me in the past, when I needed to restore this situation, not so easy. And in this case, as you see here, there was a really difficult situation in a small area. So enamel first, afterwards dentin, and as you see here, we apply enamel on the surface. We clean perfectly the surface. And I want to see everything really smooth for the first visit. And to create, for my patient, a right morphology, really important, and the color too. And in the second visit, I recreate what I had first. That's the roughness of the surface. So everything must be the same as the starting point. So I want to say now, since the time is over, hello from my office. I invite you at IDS in Cologne, where I will demonstrate in vivo what we can do on one side with harmonized, on the other side with Sonifill. And please, I invite you to save the date for this fantastic congress we have in Brescia of Italian Academy of Aesthetic Dentistry. I represent the president at the moment, and as you see here from the panel, one of the best Italian lecturer that will delight you with a fantastic presentation and lecture, and great education and great excellence for everyday practice. This is what I do every day in my clinic, and what I hope you to do every day in your office. Thank you very much for your attention. So I reply to Muhammad and saying that I create my silicone part using the diagnostic wax. I recreate after taking the model with impression, and I create with the diagnostic wax, and then I use the silicone and I scrub the silicone to just the part of the palatal side for recreating my restoration. There is another Jan Madden. What is my opinion on infection molding composite technique? Infection, or wait a minute. Yes, infection molding composite technique. I'm so sorry. I don't know regarding something is infection molding composite technique. Molding composite technique, I suppose is something that is a technique for, but infection is I never heard it. And then I have one of Veronica. What are the new material for incisal restoration? Is the new material, the material for incisal restoration basically in the state of the art is bright denting line, like a sort of spaghetti that you apply on the marginal, on the edge of incisal edge. Best polishing time is the first or the second visit or both time. Okay, I reply to Nurat that I finish in the first visit, and I just began the polishing in the first visit, and I complete the polishing in the second visit. I prefer, so my patient knows that to go back, and then if I need to make some small correction, I can do it. Okay, perfect. Why joining tooth fragment to tooth may lengthen in size? Yes, we can do anything when we have the fragment. Usually I use the fragment for recreating the original marginal edge. I love the original marginal edge, and I wanted to recreate what was in the past. To lengthen the tooth structure is not in my aim.
We would like to thank our speaker for sharing his knowledge and expertise with us today. We would also like to thank our sponsor for making this online course possible, and thank you, our wonderful audience, for your interest and participation. The CE quiz is now available online on the course page, and completing it will allow you to earn your ADA CERP CE credits. The recording will be posted online within the next 48 hours. You will receive an email notification with a link to the recording. Thank you again, take care, and goodbye.